Over the years of working with Medicare beneficiaries, we've met many clients who are dealing with Parkinson's disease. In the early days of our business, I can remember that Medicare's physical therapy rules were a significant hindrance to people with Parkinson's. There were hard caps that limited the amount of physical therapy each year that Medicare would approve. And there were also rules that physical therapy would only be approved if patients were showing medical improvement, and that's just not always the case with Parkinson's disease. Often, physical therapy is necessary just to maintain one's balance, strength, flexibility, and mobility. That's all changed now. Back in 2018, we have softer caps on therapy so that therapists have more flexibility to continue therapy if that therapy is medically necessary and is helping patients with chronic illness to maintain their current level of ability and remain independently living rather than needed assisted living or full-time caregiving. In this recent interview with Dr. Sara King from Invigorate Physical Therapy and Wellness in Austin, Texas, we learned some of the newer and more innovative approaches to physical therapy for patients with Parkinson's. What I particularly love about Sara's program is that there are online workshops, courses, so that you can access her therapy from anywhere in the country. So, if you or anyone you know suffers from Parkinson's disease, we hope that you'll gain some insight and a little hope from this interview with Dr. Sara King.
Good afternoon, Sara. How are you today?
I'm fantastic. How are you doing today?
I'm great. Thanks so much for joining us. So Facebook fans, we have Dr. Sara King with us today. And some of you may have watched an episode that we did a few weeks ago on her page where we were educating some of her clients about Medicare. And Sara knows so much about physical therapy in relation, especially to people with Parkinson's, that I wanted to bring her onto our page here on Facebook and share some of her knowledge that she has with you. So Sara has a doctorate in physical therapy from Texas State University, and she is also a certified group fitness instructor and certified personal trainer. So you are one healthy girl, aren't you?
I try to walk the walk. If I'm going to talk the talk, I try and walk the walk.
That's right. Well, I was noticing a couple of times that we've spoken, and also just in looking at your website and some of your Facebook activity, that you really have some pretty innovative physical therapy going on for people with chronic illnesses, especially with Parkinson's. Can you just tell us a little bit more about who you are and what you do?
Oh, I would be happy to. Well, as you said, I have a doctorate in physical therapy, and my physical therapy practice is in Austin, and I am 100% specialized in helping people diagnosed with Parkinson's essentially create a plan of attack for approaching their Parkinson's diagnosis. And something that I found working with this community, and I feel like is pretty present with a lot of chronic diagnoses, is the lack of ongoing education and support for the people who have those diagnoses. So at Invigorate, I try to build a platform where people can learn about how to take action against their kind of Parkinson's symptoms and then support them along the way. And it's been an awesome journey. So we actually have a couple online programs and some online forums, and it's been great. It's been one of the best, most fulfilling things I've ever done in my entire life. So
I'm really excited for you, and because I have never seen an approach like this with physical therapy, and I've been doing this for 14 years. So I have met hundreds and hundreds of Medicare beneficiaries over that length of time that have involved in some sort of physical therapy for illnesses like Parkinson's. And a lot of times also we see with MS, and also just some other times you'll have people with multiple chronic illnesses and they're approaching therapy. And I think especially one of the things, particularly with Parkinson's, is I think there's a lot of hope in the fact that you are putting together a plan of action. You're taking steps to combat your own illness instead of being overwhelmed by how you've been diagnosed with this chronic disease and what now. And so I think being able to find a website like yours where even somebody in another state can follow along with your videos and do some of that physical therapy. And what are some of the results that you're seeing with the types of therapy that you implement?
Yeah, a lot of what I implement isn't rocket science, right? It's a lot of education just on exercise and how food can impact your health, and meditation and stress. And so nothing I do has some, magic different approach.
It's not a woo-woo science.
It's not eating broccoli isn't woo-woo last time I checked. But What I've seen is when people who are able to make those small improvements every day, whether it's Parkinson's or whether it's someone with MS, or even just someone who might be watching right now who doesn't really have a chronic diagnosis but wants to live well and wants to enjoy their retirement and wants to hang out with their grandkids and travel and do all those things that we wait too long to do.
Yeah.
When they take those actions, then they see that they have even the small things like increased energy to do an extra load of laundry. Or, some people in our group really celebrate when they're able to curl their own hair again because they can lift their arm and hold it there. And that seems really trivial to some people. Or be able to bake bread again, make pies. Those are some of the small things. But then some of the big things are, we have a woman next Wednesday, actually. She's been working towards her goal of going for a 2-week, her son-in-law, somewhere abroad. And she's headed out next Wednesday. And so it can range, and everyone's different. But combining kind of knowledge about the body from physical therapy and then also wellness that is from my kind of preventative background makes all of these things accessible to everyone, including your tribe that's watching right now.
Yeah, and I think that's important because sometimes when you're facing really any kind of illness, you can often get overwhelmed with information from your doctor. So I know I've battled a thyroid condition for years, and I was really, really sick before they finally figured out what was wrong. And I do remember that one of the biggest changes that they had implemented for me was to stop eating gluten. And I remember thinking, what does that have anything to do with why my skin is turning yellow and my hair is falling out and I have all this joint pain? And it was just amazing to me that one little change in my diet had made such a huge impact in my overall health. And so sometimes it doesn't take rocket science or, some earth shattering woo. It sometimes can just be a combination of all the things that we've always been told, but then having someone like yourself to put it together into a program that's easy to follow makes it more doable for somebody that's facing an illness like that.
Definitely. Having a plan. We all like plans. Even myself as a coach, as a doctorate of physical therapy, I still prefer to sit down with someone and them reflect back to me, okay, here's your next action step, Yeah. And that's probably why everyone loves Boomer Benefits also, not to, plug that, but you walk people through those steps. Like we all just
like to have a plan.
Yep.
Yeah. So one of my questions for you was, what was it that made you, when you're pursuing your degree, decide to specialize in working with people with Parkinson's?
The long story short is I started out as a neurological physical therapist who just really enjoyed working with people of all neurological diagnoses. After people had strokes or traumatic brain injuries, spinal cord injuries, I just really enjoyed helping people get back to the really basic things that were meaningful to them. And I had a woman who was diagnosed with Parkinson's come in and tell me that her doctor had told her she was going to be in a wheelchair in 5 years. And that was 3 years ago. And she was, falling more and hurting more. And she had stopped doing the things that she loved, like making her bed, cleaning her house. She loved being a homemaker. And she came in and she said, I don't know what you can do for me, but I'm here. My doctor told me to be here, so I'm here. And the very short version of that is in about 30 days after we went through her physical therapy sessions, I think she got twice a week for 4 weeks. She was back to walking a mile with her husband in the evening. She was back to doing her own laundry, making her own bed. Her pain was gone. Her confidence was back. And she looked at me and she said, you gave me my life back. Mm-hmm. And to any physical therapist, that's like crack cocaine.
So fulfilling.
And it's a little different than most other diagnoses, neurological diagnoses, because you can see significant improvement really quickly and it can be sustainable for the long run. So I just fell in love. The Parkinson's community is one of my favorite communities, and it's been really rewarding. So
yeah,
love
I can imagine. Yeah, good for you. And it's a great group of people to work with too, especially when with our folks, and a lot of them are in that same age group. It's a generation of people with a lot of drive and will, and I see that all the time. And so when we're working with our folks here on the Medicare stuff, I think that I tell my staff when I'm recruiting people or we're looking to hire people here, I'm like, the warm fuzzy is that every single day you're going to take something really confusing and going to make it easy for someone. And so it sounds
Yeah.
very similar in your line of work. You're taking some news that would be potentially devastating, and then you're going to give them an action plan that, helps them overcome it. And so makes you sleep good at night and feel happy in your career.
Yeah, you've got to do something that fills you up, and I'm
Yeah.
fortunate to find something so awesome.
Yeah, I'm excited for you about that. So, what are some of the recent breakthroughs in physical therapy that make it so helpful for people that have a chronic health condition?
I'm not sure how much it would be physical therapy breakthrough specifically, except, there's a lot of research that's exploding now, encouraging people to exercise to help prevent a lot of these chronic health conditions. And
Yeah.
for people who do have chronic health conditions, exercise is incredibly beneficial for all diagnoses, to help improve strength and endurance and to lower stress levels, lower inflammation, which seems to be stress and inflammation seems to be at the root of most things.
Yes.
And so exercise as a whole, right, is really just growing as a preventative strategy and also a treatment strategy. And physical therapists are trained. We go through 7 years of school to be experts in how the body moves. And so we're able to come into someone's life and help them construct an exercise program with, a doctorate level of awareness of their body. So most people who have chronic health conditions have something else going on, whether they've had an old shoulder injury or they have drop foot because of their MS or whatever it is. They are able to take an expert eye and modify an exercise program so that it can be safe and beneficial. And the more education physical therapists get, the better we can kind of construct those exercise programs for people. And I think access to physical therapy is a breakthrough recently. We used to, yes. So Texas is not on that train yet, unfortunately, but I'm hoping that Texas will hop on. But that just means to those of you who are watching, if you've ever seen a physical therapist, you used to have to get a referral from your physician, typically to go see your therapist. But there are a lot of states now that you can have immediate access to your physical therapist. So if you have a fall, for example, you don't have to call your doctor, make an appointment with your doctor, go see your doctor, and then wait to get into your physical therapist. You can just call your PT and say, I had a fall. Can I come in tomorrow?
Yeah.
And so, making that access so immediate helps prevent people from becoming inactive. So even if you don't have Parkinson's, if you have back pain, the second that you have back pain, maybe waiting a day to go see your physical therapist is a lot different than waiting a week to see your primary. He's going to run x-rays, MRIs. Pretty soon it's a month and a half after you hurt your back. And now you have chronic pain. It's not acute pain anymore. And you're biomechanically malfunctioning and that type of thing. So I think that that's a huge break for therapists and for the people that we serve.
Sure. Yeah, I would agree with that. And I also think from the Medicare, and I know we talked about in our last conversation, Medicare made some changes to the rules for physical therapy in 2018. So one of the things we used to see is it was always before where people had to have this, anything with Medicare needs to be medically necessary. You've got to prove that. But one of the problems that we used to have with our physical therapy is that Medicare would limit that to the point where you had to be showing improvement. Well, for some health conditions, there isn't going to be improvement, but just maintaining your current level of function, mobility, strength, balance, all of that, as you well know as a therapist, is so important. Just for their ability to do their own activities of daily living, but also for your mental and emotional health and remaining independent. There's so much that goes into it. And finally now we're starting to see Medicare come on board with some of that and say now that, okay, going forward in 2019 with our physical therapy, you don't have to be showing necessarily improvement if we're able to see that the therapy is allowing you to maintain your current level of independence, then we're going to count that as medically necessary. And then the other thing they did is they removed some of the hard caps. So it wasn't like you only get this much physical therapy per year, and then suddenly in August you're done, and now you've got to wait 5 months before you get any more. So what kind of impact has those changes had for just the level of access that you see in your end with patients?
Yeah, I'm glad you mentioned that because that was really huge. As you know, progressive or Parkinson's is progressive and degenerative. And there are a lot of things you can do to slow that progression as far as exercise and eating well, but it is progressive. And so when your baseline is kind of this downhill slope, traditionally, then to have to prove that you are improving to stay in physical therapy when physical therapy is the thing that's preventing you from nosediving or exercise rather, then it was really frustrating. And I would see that when I was at the clinic when I took insurance, that people get kicked out after 6 visits. And it was like, that's not nearly enough. And so people now, I think, are able to utilize physical therapy as it's designed and not have to worry about insurance really dictating what care they receive, which is huge for beneficiaries. That's what your insurance should do. They should support what you need and not, you shouldn't have to cater to what your insurance wants, in my opinion.
Yes, me too.
Yes. And so it's really awesome. Now you can have a bout of physical therapy. You can, max out that number, whatever it is, but then you can go back later if you're medically necessary and get that checkup and get that, some people call it a surge, some people call it a tune-up, a boost, whatever you want. And those little touch points with your physical therapist more frequently is going to help keep you even. And I think the new standard should be at minimum keep people where they are, but we should really be aiming to improve people. And I think more frequent physical therapy visits because of this lifted cap will make that actually more visible to people, that they can actually see they're improving over time instead of improving a little with their physical therapist and then hoping they don't nosedive and, pray that they're okay next year.
Yeah. And so for those of you listening, what had happened is we used to have a cap. It was a hard cap. And so if you hit that, then you'd have to file for an exception and your therapist would really have to go to bat and go through a bunch of paperwork and you may not even get approved. And so sometimes people would just forget it. We're not even going to try to climb that mountain. And now they call it a soft cap, but basically you can continue with your physical therapy. And if it goes beyond a certain dollar amount, then Medicare might look at it and question it or ask for some additional paperwork or verification. But it's just so much a looser rule there. And I can remember talking to people, 10 years ago. I'm thinking of one particular case in my old office where, someone had been cut off on their physical therapy and it was pretty early in the year. And talking to them about, have you asked your therapist about any cash pay options? And so, that can be really devastating for people living on fixed income, because now sometimes, and many of the people that we have that come through our doors have Social Security and just a little bit of savings or maybe no savings at all. And so when Medicare would, cut off the funding, then the cash pay just wasn't an option for them. So they literally would be just waiting until January so they could get more therapy. And it's one of the better things that in my career, at least, that I've seen Medicare make improvements on.
Yeah, it's my whole world. So I don't know what other things Medicare's improved, but I pay attention to physical therapy benefits. And I'm really happy that happened. And it's getting better.
Yeah, that's really good. I think so too. Is there anything else about physical therapy that you would want our listeners to know? If you're talking to we have a big Facebook audience here, and maybe some of those folks are on physical therapy now, but maybe some aren't, but someday they may need it. What are some of the things that people should know if they haven't done a lot of physical therapy yet, and they need to know what kind of options exist out there?
I really appreciate you asking that question because what I didn't realize when I graduated, so I graduated with my doctorate in 2012. I was one of the first in my school to go, my first class in my school to get the doctorate. And so I've always entered the world as a physical therapy. Physical therapy is a profession of doctors. We go to 7 years of school. We're trained to be first line providers. So if you come and see me and you're in pain, I know how to recognize whether you have a strained pec muscle or you're having a heart attack, you know?
Yeah.
And so something that I think it's really important for your viewers as far as being able to really empower them and know what tools are at their disposal is a physical therapist, as I said, is a doctor now, a DPT degree, clinical doctorate. We don't just do massage. Contrary to most people's belief, we can do some soft tissue mobilization, some joint mobilizations. We don't just ice and heat and massage. You know, it's a lot of skilled exercise prescription, helping people in any prognosis improve their movement and their function. So the thing that I think is really awesome for your beneficiaries is if you have pain of any sort that is not intense and sharp and emergency pain, a physical therapist, you sprain your ankle, you throw out your back doing gardening or lifting your grandkids, you know, roll your ankle, whatever it is, you hurt your shoulder, a physical therapist, you know, I think it was something along the lines of 2 months worth of physical therapy is the same cost as one MRI.
Wow.
And an MRI is not going to do anything to help you improve your condition. But most of the time, you know, physical therapy can help you prevent having to take pain medication. We have an opioid crisis right now. It can really minimize how many imaging studies you get done. So contrary to popular belief, you don't always have to have an imaging study. You don't always have to get an X-ray or an MRI. You know, a physical therapist is trained to screen you to see if you need that. You know, if you turn your ankle, I know how to tell you, yes, you need an X-ray, or no, you don't, and here's what we can do. So your physical therapist can be an amazing tool to help you save money and get back in the saddle a lot faster without having to wait for all the other stuff. So if you're going to have anybody on your team as a healthcare provider, a physical therapist is one of the best, I would say, and a nutritionist, because gluten does matter. But we'll talk about that later.
Yeah, I definitely learned about that one myself, and now I've read the Wheat Belly book, and you know, really done all the research on it, and then tell everybody. You know, I'm always telling my husband, quit eating that, and he's not on board with it, but I think that's a good one. You know, and something that I was thinking about when you were talking there is I remember before I met you, I didn't even realize you could get a doctorate in physical therapy. So I think that the general public, people who haven't ever had a need for physical therapy, just don't realize the extensive level of education that people like yourself have. Some of what you just mentioned there, I had no idea.
Right. Yeah. And I don't blame you. If you don't need physical therapy, why study it unless you're a physical therapist, right? It's like me in cars. I'm like, I have no idea what's going on in the car world, but hopefully whoever's watching can kind of take that away and share it with a family member the next time that they get hurt, because it can be a really beneficial person to have on your healthcare team.
Yeah, you bet. So speaking of that, how can our viewers get in touch with you after today if they want to learn more about what you offer? And mention some of the things that are available on your website too, because I thought that was pretty neat.
Definitely. Well, the best way is to come over to our website. It's invigoratept.com. From there, you should be able to connect with almost anything as far as a couple of our online programs. We have a plan of attack workshop that's kind of for beginners with Parkinson's, and also an exercise program and a nutrition program coming down the line. So you can head over to invigoratept.com. From there, you can also find our free online Facebook group. It's called the Invigorated Community. You're welcome to join if you're someone living with Parkinson's. And like I said, that's free. We've got a lot of people in there just being a supportive community for each other. So I would say those are great places to start. Our YouTube channel is also full of awesome educational videos, and you can find us on YouTube at Invigorate Physical Therapy and Wellness.
I love it. Sara, thanks so much for joining us today. Whenever I'm talking like this, I just thinking to myself, 10 years ago, people didn't have this option. You couldn't go online on social media and have a community of other people that are battling the same disease, or someone like yourself that's in there giving encouragement. And so, it's never fun to be diagnosed with a chronic illness, but we sure do live in an amazing time where you have access to so much information and support from everyone around you.
It's so true. I know tech gets a bad rap, but there's also a lot of great things that can come out of this internet world. So thank you so much for having me. It's been awesome.
That's right. I appreciate it so much. Thanks for being here, and we'll talk to you again soon.
Okay. Bye.
All right, many thanks to Sara for her interview with us about her physical therapy programs for people with Parkinson's. If you'd like to learn more about her, you can find her online at invigoratept.com or check out her videos here on the Invigorate Physical Therapy and Wellness YouTube channel. Thanks for watching, and we'll see you in the next video.